One of the millions of people who have dental problems or maybe just need a cleaning but don't have insurance, you could be one of the thousands of people who are getting helped with just that here in Connecticut this weekend. I'm joined by Dr. Jonathan Knapp of Connecticut Mission of Mercy. You are one of the hundreds of dentists helping out at this huge event that's going on in Bridgeport at the Webster Bank Arena. I was lucky enough to meet you and see everybody else going on yesterday, but I'd like to hear from you. What's happening?
Well, Jeff, it's a wonderful event this is our sixth time doing this around various places around the state. And we typically, in the two-day event, we treat between 2,000 and 2,200 patients over the course of 2 days.
Just incredible. And just a moment ago, off camera, you were telling me how much in dollars care was provided just yesterday.
Yesterday, we saw just under 1,000 patients during the course of that day. And we delivered over $700,000, about $710,000 worth of free dental care.
Just amazing. And what kind of services can people get here?
People can get cleanings, they can get x-rays, they can get fillings, they can get extractions. We're doing some root canals on teeth and in the front. We started to do yesterday some partial dentures to give people a smile back. The lab worked on those overnight. Last night processed them all, and they're being delivered this morning. So we're helping people get a little bit of a self-esteem and a smile back. We've done that for the number of times we've done the mission, and that's been one of the points in the mission that's been very, very uplifting to see the results when people get their smile back.
Great, and I've seen you guys doing a lot of smiling through all that hard work too to help all those people. Everybody's volunteering. This is for free. People don't need insurance. They don't need to have any dental records with them. Who's eligible to come in?
Anyone. We ask no questions. Anybody's eligible. Just come on down. Right now we're at about 600 people in line already. So if you want to come, and this is the last day of the clinic, if you want to come today, I would urge people to get down there fairly quickly, because we do have there's a limit to the capacity that we can treat, because we need to get out of there and get the clinic cleaned up starting tonight and into tomorrow morning to get the equipment packed up and on its way.
First come, first served, and free.
Yes.
Doctor, talk if you would about just sort of the prevalence of the problem of people not getting the dental care that they need.
Well, because of the downturn in the economy over the last few years, it's become a much larger problem. There are estimates that around the state of Connecticut, there are as many as maybe over 700,000 to 1 million people that aren't getting the dental care that they really need for various reasons. They're working poor, and they're poor, and people that are just trying to make ends meet and having a tough time. And when you put into the mix the need for some fairly expensive dental care, it's hard to accomplish that, and some people just can't. So there's a tremendous need out here. And we can't help all of those people, but we can help the ones that we do help. It's very meaningful for them, and we raise awareness of the issue to try to help those policymakers that are looking for solutions, to try to figure out ways to make things happen for the folks that need the care. I mean, it's a tough problem, and a lot of it has to do with the economy, but we're looking for solutions.
You can only put a dent into the dental care issue, I suppose you could say, is one way to put it.
Yes.
Pardon the pun. But so where can people typically turn, though? This is an annual event. You guys work all year just to get it ready. But on a typical time, where can people who need it go to get dental care?
Well, there are oftentimes community health centers and federally qualified health centers. Those are places that people can turn to if they're in desperate need. And those facilities are doing tremendous work in terms of getting people to care and getting the care to the people. So those facilities are out there, and I urge people. We actually have a van here at our Mission of Mercy in Bridgeport that is allowing people to sign up for services if they're eligible, and trying to connect people to places that they can go to get care outside of the mission project itself.
Now, obviously, this isn't just about having a pretty smile. This is a health issue, too, because my understanding, and I don't know if this has been proved or disproved, but just for example, that not having clean teeth can lead to heart disease.
Yeah, there are correlations between your oral health and your overall health. Connections with heart disease, connections with early delivery and pregnancy.
I would think digestion too, because it's the first line of defense in digestion.
Absolutely. Proper nutrition starts with proper dentition. So healthy teeth are important to a healthy body and a healthy mind.
Is there any shift of the tide in terms of the problem that you're talking about with Obamacare and all that?
There are some things that are happening. There will be some changes in the way care is delivered. There's things going on in the future in terms of how healthcare will be delivered and reimbursed. We're still waiting to see how that's all going to sort out, because there's still a lot of unknown in terms of the implementation of the Affordable Care Act. But we're looking at that, and we're going to keep tabs on that and try to make things work to the best, to bring the care to the largest number of people with the provisions of the Affordable Care Act.
Really quickly, as we finish up too, and I finally got down to the habit of actually flossing every day, at least once. A few years ago, I finally got down to it. So for people, whether they can make it today or not, but especially if they can't, what can they do to improve their oral health?
Well, proper home care, as you alluded to, proper home care is the first and best step that they can take. Proper brushing, 2 minutes at least twice a day, proper flossing, those go a long, long way. Get yourself a new toothbrush every couple months. Make sure it's in good shape. Those things, just the simple things, and proper nutrition.
Yeah,
avoid the sugars.
Avoid foods, right?
Yeah, avoid all of that stuff as much as you can. I'm not saying avoid it completely, because everyone's allowed to have a little bit once in a while. Everything in moderation. But yes, avoid those things, and when you have those things, take care afterwards.
All right, Dr. Knapp, I hope you get a nap. I know you've been working very hard, and thank you for coming in. After all that, they're doing it as we speak right now at the Webster Bank Arena down in Bridgeport, so head on down there as quickly as you can. And of course, we have this segment going on throughout the day later on too, as well, on our website, WTNH.com. Coming up, we're going to tell you about some yoga pants that were just a little bit too short. Don't go away.